So I have a personal question for you. Are you up to date on your mammograms? It's Breast Cancer Awareness Month, so it's a good time to check in with those checkups. Numbers from the American Cancer Society show nearly 288,000 women and 2,700 men were diagnosed with breast cancer last year, and early detection is key. Dr. Iyengar joining us right now live. Good morning to you, sir. I know we're seeing younger and younger cases of breast cancer. Should we be asking our doctors for a mammogram earlier than age 40?
Good morning. That is such an important question. We certainly are seeing an increase in the incidence of younger breast cancer. A mammogram remains the gold standard of screening for breast cancer, and women beginning at age 40 should be asking their doctor for a mammogram. There are some younger women who maybe have a family history of breast cancer or a genetic lesion that puts them at an increased risk for developing breast cancer. Certainly, if you have a family member, particularly a first-degree family member with breast cancer, starting at age 35 or even younger, a person in that situation should ask their doctor whether or not a mammogram with an ultrasound would be a helpful screening technique.
Yeah, and I have to ask you something, because I've been told for many years by my doctors that one of the best things you can do to prevent breast cancer is take a lot of vitamin D. Is that still widely believed?
Well, I think in general, living a healthy lifestyle is a tool for preventing breast cancer, and certainly maintaining a healthy vitamin D level is part of that healthy lifestyle. I generally advocate for getting that vitamin D from your diet, eating a plant-forward, whole food, minimally processed diet. And for those individuals who are not able to keep their vitamin D levels up through diet alone, supplementation can be helpful.
Plant forward. Markie, I think you and I are both plant forward.
I love
I've never heard this term,
diet.
but I like it. Yes. I'm going to be plant forward from now on, and still eat steak on the weekends. What is thermography? What's the difference between thermography and mammography?
Well, thermography is a different type of technology. It uses infrared-based technology to detect abnormalities in the breast tissue, whereas a mammogram is an X-ray-based technology to detect tumors or other abnormal-looking areas in the breast tissue. A mammogram remains the gold standard for screening for breast cancer or early breast cancer. Thermography is a newer technology, but it still requires a mammogram to confirm whether or not an area is abnormal. So most of us are still using mammography, and there are now newer types of mammography like 3D mammograms that are even more sensitive for detecting early breast cancer.
So you might as well just know you're getting the mammogram, so you might as well enjoy it. I found, before I ask you one more question, doctor, that sometimes you got to shop around. You know, if you have a bad experience at a mammogram, like where they feel like they're just crushing you, you're in the crusher, there are other clinics where they're a little gentler. I've had a much better experience in recent years by going to different boutique kind of mammography places. But what do you wish patients knew that they're not talking about or not asking about with their doctor when it comes to breast health?
Well, I think there are two major issues that we need wider appreciation for. And one is that the mammogram is such a useful tool for detecting early breast cancer. And certainly, as you said, it could be uncomfortable, and I have many patients who tell me that. But as you said, finding the right place for you, but importantly, finding a place that really gets in there and takes as many images as they need, even if sometimes that means calling you back for additional images. It's really important to get a clear view of what's going on in that tissue. And the second piece is that first point that I made, is that a healthy lifestyle is really important for lowering risk of breast cancer. And that includes diet and physical activity, limiting alcohol intake, and generally living a healthy lifestyle.
All right, put down the wine, ladies. Go for a walk. Dr. Iyengar, thank you so much. We'll be plant forward from now on, too. We learned a new word.
Yeah.
Great.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.